Welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board certified veterinary dentist, and we come to you every week on Wednesday to provide the veterinarian and the technician team some actionable things that you can use in your practice. And this episode is going to be a recorded episode that we've done in the past, not a podcast that we've recorded or not the Vet Dental Show, but actually some other information for you that we know you're going to enjoy. So sit back, enjoy, and we'll see you at the end of the podcast.
Question regarding x-ray about getting that caudal maxilla and getting those teeth. And she made a comment regarding the last two molars and the fourth premolar and getting that all in one view. And it really depends on the size of your patient. So I have a couple of examples here. In a small dog, you're going to get all of those and the mandibular molars as well on one view. But that's a small dog template, which is 10 spots, 5 in the maxilla and 5 in the mandible. But with our larger patients, we use typically a 19 spot, and that's for patients that are 40 pounds or larger, and everything up to a 200-pound Mastiff. I've used this 19 spot. But it allows us to get more shots. So the caudal maxilla typically looks like this, where I have the last two molars and that distal root or the back root of that fourth premolar. This is on the left here that we're looking. And then moving forward, that fourth premolar, the mesial or the front part, and the third premolar. So the caudal maxilla is done in 2 shots primarily. And this is a point that really needs to be stressed here, that dental x-rays, you do not need to have the entire tooth on one view. As long as you've got enough overlap and enough of the tooth either on one or the other that you can see the entire tooth by putting those 2 x-rays together, it's absolutely okay to split that view up. And with a large dog and a number 2 sensor, that's just what fits on there. The last 2 molars and the distal root of the fourth. And then we move that sensor forward and we've got the rest of the fourth premolar and all of that third premolar. That's what the caudal maxilla looks like in a large dog. In the mandible, and now this is on the right side, the mandible, kind of the same deal. We've got the last 2 molars and the distal root of that first mandibular molar. And that's a big tooth, but this is what fits on a number 2 sensor. We for sure want to get those last 2 molars. And then moving forward, I've got my mesial root or the front root of that first molar, as well as my fourth premolar. So this is, again, 2 shots to get the caudal part of the maxilla or mandible in a large dog. And my template compensates for that, and I have enough spots to be able to do that. Hope that helps you. In regards to templates, what do you do if you need to get a repeat shot, if it doesn't come out the way that you want it, you need to repeat that? And you mentioned here your little additional comment, an off day. Just because you don't get the x-ray in the first shot does not mean you're having an off day. It just means that we need to do a little troubleshooting. Dental x-ray was never meant to be able to get every single shot in one shot. And that's the big myth with dental x-ray, and the big problem with dental x-ray, because no one really is teaching a lot of troubleshooting, where if I don't get it in that first shot, oh my gosh, what do I do to get it to be a diagnostic shot in my very next shot? And when we talk about troubleshooting, we're going to recognize what the error is and then make that adjustment. And that's one of the things we cover specifically in a live lab. And when you're taking x-rays as a group, we evaluate, is it a diagnostic shot? What are we looking for? Can we see all the structures we need to see in order to diagnose a radiographic image of a tooth? And if it's not diagnostic, then what do we need to adjust to make sure that it is diagnostic in its next view? I've been taking x-rays for a very long time. And I started on film, the little chairside developer where you would put your hands in and develop the little film. That was just a nightmare, but that's how long I've been taking dental x-rays. And I don't get a perfect shot every time I take an x-ray. Absolutely not. But I know very quickly what adjustment to make to get a diagnostic view in my very next shot. And with the advantage of digital and having that direct system where it plugs right into my computer and I get my image pretty much instantaneously or within a second or two, there's not that much of a delay. I'm just making that adjustment quickly, retaking my shot, and boom, there it is. Not that you're having an off day, we just need to troubleshoot a little bit, and that happens. Dogs are different sizes and different skull types. One rule isn't going to be covering every single thing. Sometimes we have to make little adjustments. But as long as we know what adjustment to make to get that diagnostic view. Now, back to your question as far as the template goes. This is true for Midmark, but all of the software programs have the ability to retake an x-ray. And it's usually labeled as reacquire or reacquire sequence, something to that effect. And with Midmark software, you're going to hit the pause button, right click, and that drop down menu will give you the ability to either add a view if you want to take an additional shot of an area. For instance, if we're looking at an oral mass and trying to evaluate the bone all around in that area, I may want to add a completely new shot to cover more area. Or we can simply replace that view. If the view is just absolutely useless, nothing on there that is going to give us any information, it's way off, I just replace it and take a whole new shot. You do have the ability to retake views. And again, with templates, if you're taking x-rays currently and you're able to get every view in 1 or 2 shots, then you're absolutely ready for templates. And I would highly encourage you to get in the habit of practicing with a template, using a template. It's going to really improve workflow just because of how we can just continue taking shots without having to go to that computer every single time. If you're having to repeat shots over and over again, the template's going to slow you down a little bit and would require some more practice so that you can get those diagnostic views in 1 to 2 or 3 shots. Now, my computer sits far away from me when I'm standing at the front of my dental table. My computer is up over on the counter and it's hooked up to a big screen TV, as you saw in the first segment and when we were outfitting our dental operatory. So I've got that mouse right next to me that I can manipulate my computer, and if I need to retake a shot, I can do that right from where I am at that patient, where I'm not wasting steps, having to walk away, walk over to my computer. I can stay right there and do a couple of clicks, get my software set up to retake that shot, and then move on from there. So just those little things that eliminate those wasted seconds of having to walk away and come back. And it is only seconds, but those seconds add up over time. And especially with a patient under anesthesia, we want to minimize that as much as possible. So if you can set up your workspace where your workflow is really efficient, that's just going to make things better as well. And that's what templates do, is just increase our efficiency. All right, the study for the non-vital teeth that I talked about in the last Q&A, where some of these x-rays that we take, or we see discolored teeth, and it's just a wait and see kind of situation. And in most cases, we know that a non-vital tooth, a discolored tooth, is going to cause problems down the road. And we want to practice proactive dentistry. And knowing that in most cases that tooth is going to be a problem, we're going to want to take action and not just wait and see. And this is the conversation that if your docs are in the wait and see group, we need to kind of school and educate a little bit. Now, that being said, this is the study here, and this is just the McNuggets here of the study, but they evaluated 84 essentially discolored or non-vital teeth, and actually evaluated those teeth grossly by opening them up and actually looking at the pulp, and there was absolute pulp necrosis in about 92% of those teeth. So that's a pretty big statistic. Now, anytime that we talk about really anything, it's never an always or never kind of situation. We don't go to those extremes. For instance, if I've got a 12-year-old dog that has little to no pulp, which is not unusual with older patients as those teeth mature and those layers of dentin get laid down, that pulp can get really small, and sometimes we get complete pulp obliteration where the pulp is completely gone and it's just all hard tissue of that tooth. If I've got an 11, 12, 13-year-old dog with a discolored tooth, the x-ray is normal, meaning there's no periapical lucency, there's no bone loss, there's no change in the periodontal ligament. Are we going to do something with that tooth? Not at that point, no. Because it's got such a small amount of organic material at this point, that tooth is mostly hard tissue, hard dentin. And when we talk about an infected tooth or a non-vital tooth, the younger they are and the more organic material, meaning pulp, the guts of the tooth, the blood vessels, the nerve, all of that, those soft tissue components of the tooth, the more of that's in that tooth, the more likely it's going to become infected because it's just more stuff for the bacteria to feed on. So we have to look at the big picture, and if we've got a 2-year-old dog with a discolored tooth, yeah, absolutely, we're going to recommend first root canal. If it's a strategic tooth, like we talked about, canine, fourth premolar, we're going to recommend root canal, or we're going to recommend extraction at that point. We're not going to wait. With a 2-year-old dog, we know that tooth's going to go south, and it will eventually cause infection around the root or apex of that tooth. We know pretty much 92% chance that's going to happen. So we're going to recommend taking action at that point and be proactive and save that dog some grief down the road. Because remember, even when that happens, the patient's not going to let us know. The only way we're going to know things are happening is radiographically. And the patient is only clinical when things are really bad. And we don't want it to get to that point before we take action. So we're going to be proactive. Same thing with root tips. It is absolutely recommended to go after root tips, especially if we're doing an extraction and we fracture a root. Yeah, we've got to go in and get that. We see a lot of patients from referring vets that have had previous extractions with root tips still in place. Again, a 13, 14, 15-year-old dog where there's a root tip there, there's no radiographic changes, it's just sitting in the bone, it's not causing any issues. Are we going to go after that root tip? No, not at that point. In those older patients, again, if it hasn't caused a problem by that 10, 11, 12, 13 years of age, it most likely is not going to, so we don't necessarily have to go after those. So we have to take that into account in the big picture of what kind of patient are you working on, and move on from there. But with our non-vital teeth, especially in younger patients, and non-vital, we're looking at, this is primarily based on discolored teeth, where we see a discolored tooth, and a lot of general practitioners are just, let's just wait and see what happens. And this is where we run into that issue of the patient suffering in silence because things are most likely going to happen, but the patient won't tell us. We're going to do things proactively. But this is just the most important kind of what the conclusion was when they completed this study as far as what they found.
I hope you enjoyed this episode. There's a lot of actionable items in there that you can take and use in your practice immediately. So put those to work and enjoy the benefits for the practice lifetime in your dentistry service. So until next week, have a great week. Take care, guys.